Thank you ever so much for joining this CHiMES Unplugged event, the first of its kind for us, and in celebration of 5 years of the CHiMES Research Group at the University of Oxford. My name's Kamaldeep Bui. I'm a Professor of Psychiatry at the University of Oxford in the Department of Psychiatry. We're going to be telling you a little bit about the CHiMES Group, but before I begin, I just want to alert people that we're recording this and this will be shared on YouTube eventually. Please don't use any AI or chatbots. If you can, disable them because of confidentiality. And when there are Q&A, please can you put them in the Q&A rather than the chat so that we can marshal those carefully and make sure we address those. So I'll begin by just introducing a little bit about CHiMES, and there'll be plenty of time for discussion. We've got some exciting speakers to tell you more about the detailed projects. But CHiMES is an interdisciplinary creative collaborative, bringing creative thinking and creative practitioners to help us tackle health inequalities. In particular, we're drawing on cultural, ecosocial and syndemic models of illness, rather than only the biogenetic and biomedical, which are important and have their place as well. We're guided by very strong values frameworks, which are trauma-informed, and we promote good research cultures and encourage early career and mid-career researchers, clinicians, as well as researchers to progress in their lives and careers with us. The history of CHiMES is it began with my marked interest over several decades in ethnic inequalities in the experience and outcome of severe mental illness, both the incidence of psychosis, but also coercive treatments over a very long period of time, and beginning to try and understand the interaction between the personal belief systems as well as service structures, initially to improve health services and care and support, and particularly to avoid coercion. And then over the years, we've looked also at public health models and prevention and health promotion. That's where the ecosocial comes from, and life course methodologies to support care and improve services. Central to all of this is that addressing ethnic inequalities and inequalities in general is difficult. It's a wicked problem. There are complex, multiple layers, and therefore the problem often changes as you're trying to solve it. And one of the challenges we've always had is we've always found solutions that don't seem to work for everybody. So we've gone to giving priority to experience data, ethnography, and better understanding the world in which we live through experience, not seeing it as something which is only subjective and to be dismissed, but holding true knowledge and true data about how things work for people. So this is our unique combination of both using experience data and multiple methodologies from the social, anthropological sciences and humanities, alongside statistical and epidemiological data. And we've adopted an experience-based co-design model in most settings, in most of our research projects, where we try and develop solutions and then test and pilot them and progress them towards trials. CHiMES works closely also with the World Psychiatric Association's Collaborating Centre, which I lead at Oxford, and a number of other partners who remain engaged with us through our various projects. The projects include the Synergy Collaborative Centre, which ended, but it was a very important project looking at ethnic inequalities and trying to change the structures. And it started pre-COVID, and of course, COVID exposed many of the inequalities that at the time we were struggling to make visible and surface. We have a number of other projects: Co-Pact looking at the Mental Health Act, Co-Pics looking at multiple morbidities, POSI Just Commission looking at postpartum mental illness, ATTUNE looking at adverse childhood experiences and how they unfold over the life course, again drawing on experience-based methodology, and ATTUNE in particular, but some of the other projects also draw on creative methodologies, visual arts, performing arts, etc. And you'll hear a little bit more about that later. This is also linked partly to the National Institute of Health Research's BRC, where we're undertaking some work on improving patient and public involvement and drawing out what research inclusion really means, how we can ensure that those voices that are underrepresented in research and policy and practice are truly given some power in the dialogue and have opportunities to have their knowledge understood and responded to, particularly if it's difficult to verbalize their experiences. And that's where our creative and multiple methodologies come into scope. I'm going to stop there with that brief introduction. I think that's quite a full introduction and comprehensive. Do look at our web pages if you want more examples of how we do this and our projects. We thank all our funders, the MRC, HSDR, UKRI, ESLC, and multiple other partners as well. And I'd like to give a personal thanks to colleagues who have helped coordinate and organise this event, Eva, Sheen, Victoria, and Simran, and of course all of our speakers, in particular Jack and Davino, who will be speaking this afternoon. With that, I'll hand over to Rasheen now, who will chair the rest of the event and with our esteemed colleagues, manage any Q&A later. So do put your Q&A in the Q&A box, not the chat as we go along, so we can pick those up at the end. Thank you ever so much. Have a wonderful afternoon. I hope you really enjoy the event, and we're looking forward to holding a lot more of these.
Thanks, Cam. I'll just try and switch the cameras over. So thanks, everybody. So just to kind of, I guess, remind people, the aim of this CHiMES Unplugged webinar was to really think about how we as a research group engage with kind of the broader academic community, all the people who participated in our research, and all the different collaborators that we have, both in charitable spaces and in policy spaces, and to really think about how we communicate some of the things that we're learning in the process, as well as the findings of our research, and provide space for conversation and discussion around some of the more messy things that happen in research that we don't always get the opportunity to talk about or report in academic journals. So today we're going to talk about 3 projects within the CHiMES Collaborative group. I'm going to start by sharing a little bit about Co-Pact. Then we're going to move on to another project, Co-Pics, and then we're going to end with a very exciting project called ATTUNE. For each of the projects, we'll probably only speak for about 5 minutes, and we'll leave about 10 minutes for discussion. Because like I said, we really hope that with these seminars, we can kind of grow a community around this type of research and provide lots of opportunities for people to have conversations with us to help us advance our thinking as a community. So I do have some brief slides. Okay, so a slight whistle-stop tour. Co-Pact was commissioned by the NIHR Policy Research Programme in response to the reform of the Mental Health Act. This was actually kind of passed through Parliament last year in 2025. The Co-Pact project really wanted to centralise the voices of people with lived experience of being detained under the Mental Health Act, and was really interested on shining a spotlight and focusing on the different forms of ethnic inequalities, and really ensuring that different forms of marginalisation and marginalised populations were well represented within the study. So this started off with the first work package in the centre of this diagram, which was a photo voice study, where people who had been detained under the Mental Health Act in the preceding 2 years took images and used those to share their experiences. These images then informed a series of co-design workshops, which then kind of related to like a big national knowledge exchange event where the different NHS trusts that had taken part in our work had the opportunity to share their findings with each other. We also had the opportunity to present our findings in the House of Lords and have since published some of the findings. All of the images can also be found displayed online, and we've had lots of photographic exhibitions which have been incredibly impactful for all of those who attended. This work was conducted across a number of sites across the UK. So we had sites in Bradford, in Derby, in Birmingham, as well as in Oxford and in London. And as you can see, it was really important to us that people with lived experience were meaningfully involved throughout the programme at all levels of governance throughout the research. So we had people with lived experience who were facilitated to be co-applicants. We had the advisory board was co-chaired by somebody with lived experience. We actually facilitated some of our participants sharing their experiences on the radio locally in Birmingham. We had participants present at co-design meetings, and we also had participants present in our knowledge exchange events. And I think photo voice data can sometimes be quite abstract to people and difficult for people to understand. So I just wanted to include here an example of some of the images that were shared within the context of this study. So without going into kind of too much detail about the methodology, because like I said, we did want to keep the kind of description of the project fairly short and brief so that we've got lots of space for discussion. But the kind of key findings that we shared from both the kind of photo voice data and the co-design workshops that we really wanted to highlight to policymakers were these kind of 5 key action points. The first one was around the public awareness around mental health. A lot of the participants who took part in our work kind of really shared experiences around stigma and people not really understanding what their experiences were and feeling that they'd gone into hospitals to get better and not recognising the amount of trauma that some people experienced as a result of being detained under the Mental Health Act. People felt that there needed to be better mapping and more joined upness in community services, and perhaps thinking about extending access to advocates in the community. There are lots of kind of processes around advocacy once someone's been detained under the Mental Health Act, but people felt that actually that needed to start in the community to better understand and navigate the different forms of support in the community. There was also a call to kind of co-design new standards of inpatient care. So there were lots of very dehumanising experiences that people shared with us once they were detained on mental health wards. And it was really recognised that although a lot of the staff obviously were there to do their best and were put in very difficult positions, a lot of the participants actually shared quite dehumanising practices like queuing up for medication, not being given information properly, and actually quite dehumanising and very oppressive environments. It was also felt that access to advocates should be provided on an opt-out basis rather than an opt-in basis, and I think that is a recommendation that is represented in the new version of the Mental Health Act. The next recommendation was about how professionals interact with family and friends. So a lot of people reported to us that they were detained quite far away from their family and friends, which made it very difficult for them to access their support networks when they were detained. And other people reported to us that even when they were detained locally, it was really challenging for their friends and family to contact them and to be involved in their care. Others did also share that where family and friends had been able to visit them, this meant that staff were more accountable, and actually they felt that people who had a support system and had friends and family available received better treatment because the staff felt there was a form of accountability there compared to people who didn't have a support system in place. Discharge plans were talked about quite a lot, and it was recognised that advanced agreements could be incredibly helpful. However, people did share a hesitance around the potential for very generic advanced agreements, or where it was kind of national support phone lines that were put into prevention plans, and actually they wanted to ensure that discharge plans and any advanced agreements were very personalised to an individual and really recognised what's important to that person at a time of crisis. And finally, people wanted better access to talking therapy. So it was felt that it was a very medicalised model where there was a very large focus on medication. And actually, during an admission, they felt that it would have been helpful to have access to talking therapy rather than just medication. And afterwards, there was often a gap where people would be put on a waiting list to receive talking therapy. But that was actually quite a time of importance where people felt that support would be very beneficial. And finally, unfortunately, we weren't able to have one of our participants join us today, but we do have a video. So I'm just going to share kind of the last 30 seconds of this video with you. Hopefully the sound will share as well, but if not, I can put a link to this in the chat. I think it's really useful because it shares one of the participants talking about their experience of taking part in the project. Just want to fast forward to...
Because you give me an opportunity to try different things, talk to people on a different level. That it has given me like a bit of hope. So I can say to myself, you know what, there is a bit of help now for mental health people. It's getting better. Like I pray to God and really do that. It does get better.
Okay, thank you. Did anybody have any questions about Co-Pact or any of the work related to that project? If not, we can maybe move on to Co-Pics and then we can have a fuller conversation about all of the projects afterwards. So I think for Co-Pics, we have Davino, who's one of our peer researchers from McPin, who's going to present the project for us. So over to you, Davino.
Hi, everyone. I am Davino from the McPin Foundation, and as Roshan mentioned, I am a peer researcher from McPin, and I'll be speaking about the lived experience reflections from the Co-Pics project. So I'm going to provide a quick overview of the Co-Pics study and reflections on how lived experience was involved throughout the project from a peer research perspective. So the Co-Pics study, the study aims were to improve the care of diverse people living with psychosis and multiple long-term health conditions by learning about their experiences and using this information to co-design resources. And the methods we employed were capturing experience-based data using photo voice in Work Package 1, biographical narrative interviews in Work Package 2, and this fed into the experience-based co-design workshops for Work Package 3 and will feed into the readiness for implementation stages in Work Package 4 and the economic evaluation in Work Package 5 in the future. So lived experience involvement was at all levels in this project. So we had a leap of 8 members, a lived experience advisory panel of 8 members. We also have currently 5 peer researchers working on the project, and in the leadership, we had 2 patient and public involvement co-applicants. So how did lived experience inform recruitment? Our peer researchers and lived experience co-ops ran the LEAP meetings, and in these meetings, we were able to co-create a logo, which you can see here, a list of organizations to contact for recruitment, and also the LEAP were involved in reviewing the recruitment materials. Also, peer researchers were involved in contacting these organizations. So as you can see from these diagrams, the recruitment was a success, and we were able to have a wide range of representation from ethnicity, as well as age, and also a wide representation of physical health conditions. The majority of these were diabetes, cardiorespiratory, and kidney disease. So how was peer research involved in Work Package 1, which was the photo voice workshops? So the LEAP were involved in providing feedback on how the photo voice sessions would work before we ran the photo voice workshops. During the photo voice workshops were co-facilitated by the peer researchers, and after the peer researchers contributed to the analysis of the data. And how did lived experience inform the data collection? So before, peer researchers arranged interviews with the participants, and during, peer researchers led interviews in pairs, and after, peer research reflections contributed to the analysis of the data set. So some of the peer researcher reflections as a group was, we reflected that as peer researchers, we acted as a bridge between worlds, between the participants as well as the academic team. We also reflected on disclosure. So some of the group had to navigate, the group had to navigate the levels of which we felt comfortable disclosing our own lived experience. And as peer researchers working on the project, there is an implicit level of disclosure, but some of us also felt more comfortable to explicitly disclose lived experience to participants. And as a result of that, because of this implicit level of disclosure on all levels, there was a shared understanding between participants which helps lessen the hermeneutic labor of them having to feel like they have to explain themselves. Another peer research reflection based on the experience-based co-design workshops was from one of our peer researchers, Ashley. Was something else that struck me as a peer researcher was the difference in how success was perceived. And also there was a reflection on the fact that there was a blurring of the boundaries between patient participants as passive objects of research for data extraction versus active participants in the creation of the data. Any questions?
I can't see anything in the Q&A, Davino. So I think maybe if we move to Attune, and then we can have a discussion with all of the speakers and some questions. So I think for Attune, we have Simran, who's our project manager, and Jack, who is someone who's worked on the project, who are going to present.
Thanks, Rasheen. Yep, so Attune. So Attune is a UKRI-funded research project that began in 2021 and we finished last week. So we are just in the post-project stage. Attune had 6 work packages. 4 of them are represented here as our main information finding phases. So we had work package 1, which was where we did creative arts workshops with young people. And at the same time, we're analysing existing data sets, Head Start, Cornwall, Dash and Reach in work package 2. And then these summarised and informed our co-design phases of work package 3 and 4, which Jack will tell you more about in a bit. We had young people involved in our YPAGs. So each of our sites had a young people advisory group. So there was one based in Cornwall, London, Oxford, Kent and Leeds. And then we also formed an overarching national YPAG to help inform things such as our dissemination conferences, events, and any other event that we had young people speaking at. Jack did many of those and can speak to those for us. And I'll just hand over to you, Jack.
So yes, as Simran said, we've been running since 2021 to 2026. I started off as a young person. I still maintain I am still a young person, as much as it might be difficult to argue that. So we've had 144 plus outputs, which has included 30 films made with and by young people, 33 podcasts, 18 publications, which I believe we're getting another journal article published very soon. And that's come from 44 staff members across the UK in 8 universities and beyond, in Leeds, Falmouth, Oxford, London, and I hope I'm not missing out any more, but we'll see if I have. And that's included a game as well, Ace of Hearts, which we'll be talking about a little later on, and validating voices as well.
So the overall aim for Attune was to understand adverse childhood experiences using creative methodologies. So we worked with young people from a variety of different backgrounds and diverse communities. So we worked with the Kent Refugee Action Network and Ukrainian refugees based in Cornwall. We also worked with the Gypsy Traveller community, multiple LGBTQ plus groups, young people with learning difficulties and disabilities, and marginalised populations around England. So we tried to be as inclusive and as accessible as possible, making sure that there was room for in-person workshops as well as meeting online as well, just to facilitate those conversations. Jack?
Yep. So this is some of the 1,500 plus pieces of individual artwork that come from the young people that have been collected through Work Package 1. And we can see in these, and I hope you'll take some time to read them as I talk, it speaks to the power of art and research and the way in which art itself can be used as a powerful way to discuss adverse childhood experiences for young people instead of necessarily sitting in an interview about it. And it can get into what necessarily they might not be able to express through words, but express through art. And that has helped to drive us and drive the research. So, for example, one of the outputs, the alternative prospectus, has come from some of the artwork that we've seen in work package 1 that spoke to school experiences and the experiences of adverse childhood experiences in the school environment. Some of these have come from zines in Cornwall, workshops with different communities in Kent, and all across the country. This is the resource that was made with work package 3. So it was made by Siobhan Hugh-Jones at the University of Leeds and Luke Alder at the University of Kent, as well as several others. And was created really in response to work package 1 and 2 and the importance of validation and invalidation, conversely, from that, and the harm that repeated invalidation for young people was seen to have, especially as ACE-affected young people. So Validating Voices is a resource for public sector work settings, and was co-created with young people aged 12 to 24 to help professionals have a more helpful and validating way of discussing everyday conversations with young people who've had adverse childhood experiences in order not to replicate invalidating experiences and to learn better practice.
Our other output was a digital game called Ace of Hearts, and this again was co-created with young people through multiple co-design workshops and working with the game development team in sprints based at the University of Falmouth. So again, we were looking at the data that we collected from work package 1 and what was coming out of work package 2 to speak to our young people and see what they wanted to discuss in these games. So we have Horse and Foal, which talks about bereavement and a young person becoming a carer. We have Dial It Back, which is about a young person living with a disability. We have Hard Times, which is about a young person living in financial crisis. And we have Out of Shell, which is a young person with body dysphoria. So overall, over the many busy 4 to 5 years, what did we learn? We learned that adversity is broader than we thought. It includes school adversity, masking, neurodivergence, and invalidation, not just home life. A lot of our young people pointed out that some of the childhood adversities that we currently look at are a bit outdated, and there are new adversities that they face, such as cyberbullying, masking, sensory issues, for example, that we need to start thinking about and including. And as Jack mentioned, current environments that feel unsafe or invalidating can drive distress more than the past events alone. And making invalidation a key harm mechanism, feeling unseen or unheard can lead to shame, anxiety and relational insecurity, and constant invalidation can keep replicating those feelings going forward rather than letting the young person heal over the past event. From work package 5, which was our health economic modelling work package, we learnt that ACEs have measurable life and economic costs, and that more adversity is linked to lower well-being, quality of life and future opportunity. And overall from ATTUNE, I guess one of the biggest impacts is that we know that arts and co-designed interventions do work with young people, and that creative youth-informed approaches increase engagement, reflection and help seeking. Jack, do you have any final thoughts to leave us with?
I think the emphasis that I would say is the importance of, in this project, of young people's voices and how much young people have been listened to, and the importance of the validation that this project has brought with young people's voices.
Thank you for listening.
Thanks, Jack. Thanks, Simran. That's fantastic. And thank you, Davino, as well. Did anybody have any questions at this point? If not, I wonder if I could just ask everyone who's spoken to turn their cameras back on. If not, I can definitely think of a question for Jack. Did anybody have any questions? If not, I'll kickstart things. So Jack, you just spoke then about how important it was in terms of, as a young person, feeling validated in the research space. I just wondered if there's any examples or anything you feel that the research team did really well that facilitated that experience, or kind of as a young person, what that experience was like for you of feeling heard and validated in those spaces.
I think it's a careful negotiation between and sort of the building of relational trust. We've written a research paper on this and recently had a webinar with the Create project, which is ATTUNE's sister project, about this and how important it was for young people and researchers to sort of build a trust together. And that, I think, has helped so much in terms of researchers and young people feeling like they can work together so well. And the trust and the willingness to give up some of the power that is in the researchers' hands and give it to young people has been so welcomed and so inspiring for us, and it's something that we can try and take and use as a stepping stone for our experiences and our own opportunities to help advance the research.
Fantastic, thanks, Jack. Simran, did you have anything that you wanted to add to that from your experiences of working on ATTUNE?
I think it is just as Jack said, and it's having the space to have those open and honest conversations with the young people and bringing everybody to the same page, even though we're all from different backgrounds and experiences, just to level the playing field and make everyone feel like they're in a comfortable environment where they can just openly be themselves and say what they want to say. And I think with ATTUNE, we've been really lucky that the young people that we started with at the beginning have stuck with us throughout the whole time, and we've just built those relationships up more and more and more, to the point where we are quite comfortable and we know how each other works and we know what we can rely on one another for, and that we all are the same amount of passion and belief in ATTUNE, and because of that we're quite happy to work even more together to make sure that we produce the best outputs and have the most impact.
Fantastic, thank you. I can see that there is now a comment on the Q&A from Charanjot, which asks, what was the difference in how success was perceived? Was that in relation to a particular project or outcome? I don't know if you want to turn your microphone on to expand at all. Want to add to the comment? For Co-Pics, so for Davina, what was the difference in how success was perceived?
I might
there
have
we
to
go.
pause.
Sorry, my mic is working now.
I think
Thank you. Davina, it was just particularly a quote that you'd written from, I think, one of the peer participants who said that they were surprised about the difference in how success was perceived. So I just wondered what that difference was.
I think I might have to pass that question over to you, Rishan. I'm not sure if I can recall exactly the context of that quote. I think it was to do with success in terms of how design of the care services would actually look like and what success would mean to the participant, but can't exactly quite recall.
Yeah, I think it was a peer researcher quote perhaps, but I think it is important. I think one of the things that I've definitely learned along the way of doing a lot of research of people lived experience is around managing expectations. So I don't know, Davina, if you can speak a little bit about maybe what your expectations around Co-Pics were coming into the project compared to what your experiences have been now, because I know particularly around kind of creative methodology and photo voice, like some of those concepts can feel quite abstract walking into a project like this.
Yeah, so I guess in terms of managing expectations, I think when doing lived experience research, it is really important to understand that you can't you might not necessarily be able to change everything, but in terms of managing your expectations and kind of the work that we've done with Co-Pics, I think the way the project has shaped out and been able to involve so carefully and considerately the lived experiences of the people who we have worked with for the experience-based co-design has been really like beautiful to see and important. Yeah.
Thank you.
Victoria, did you have something you wanted to add there? So Victoria is our project manager for Co-Pics.
I'm not sure if it quite links to it, but what I found challenging in some ways was when we had the co-design meetings, then we have all these ideas and suggestions, and it involved patients, carers, and professionals, including third sector. But then we had to go back to those trusts and then look at what can be implemented, and then balance what the lived experience voice said was needed and actually what the trust is able or willing to provide, and then balancing that. And some things I think reduced from what was originally planned, and then we've had to try and balance that and push back and bring in the lived experience voice again. And then other trusts actually expanded and more has happened and things have come off the back of that even. For example, at Oxford, one of the implemented co-design actions was setting up a peer support group specifically for marginalised communities, because from the study, what patients and carers were saying, they didn't feel like there was a space that they could share their experiences and feel comfortable. And so Oxfordshire Mind had been contracted by the trust to deliver that. And then when we met with them last week, they said off the back of that, they've actually been reassessing all of their groups, and they found that 20% of their SMI, their serious mental illness, sort of people on their kind of books had psychosis, but there wasn't a psychosis group. So actually now they're setting up, aside from the action that came from Co-Pics, specifically for marginalised communities, a broader SMI group. So it's been interesting how it's been very sort of trust specific, and then what we're looking at is how those actions could be sort of implemented across NHS centres, and some of those very specific barriers and facilitators, and almost having to localise broader actions. But also there has, I think, probably been some disappointment with some of our participants where they felt that what the action wasn't quite what they had intended. So it's that sort of balancing between what's feasible with the trust, and it's quite a difficult system. And we've spent probably 6-7 months working with the sites trying to get something which seems fairly simple on paper actually implemented. So what we've tried to do is just keep that lived experience involvement. So we've gone back to the lived experience advisory panel, we've gone back to the participants who wanted to continue to be involved. And then some of that feedback then has improved it. For example, we had a medication leaflet, and then when we went back to lived experience, they were saying, well, what about the different languages and Braille? So then we go back to the trust. So we have tried to manage that, but I think managing expectations is a challenge in that context.
Yeah, and I think there's a really important point there as well that was also reflected in Co-Pact, in that I think when we conduct research in NHS systems, we assume that they're all the same. But actually, I think different sites actually operate very differently, which I know is one of the challenges that we've experienced on both of the projects. And actually, there is a real need to work at a local level and think about how that interfaces with national impact as well. We've got another question in the Q&A, so it's for Jack and Davina. So could you share with us what has been your most what has been the most challenging part of working on the projects, on the research projects that you've worked on? And potentially how you've overcome that.
I think perhaps the most challenging, well, one of the most challenging definitely has been I am a historian by research. I am not a psychologist. I am not an artist. So when it has come to sort of disseminating and being involved and doing all of these wonderful jobs that I have been able to do through Attune, it's been a learning curve and been a learning process in order to understand what on earth people are talking about to begin with. When I started, I did not know what a work package was. I didn't know what economics really sort of was. Now I'm sort of learning more and more and more. And it's a wonderful thing, but also at the start, it is a big learning curve, I would say. And I think that would be probably one of my more difficult parts that I've had to overcome.
Thanks, Jack. Davina?
I think one of the most challenging parts about Co-Pics was doing some of the biographical narrative interviewing, and having people so graciously recount their life stories that have been quite traumatic. And I think that's probably the most difficult part, because you kind of have to self-manage yourself in order to contain how you feel about the things you're hearing in order to continue the interviews, and work through those things. And like some days it was a lot easier than others, I guess, depending on what's going on in the context of your life. Like it's easier than other days to go through an interview, like in length, hearing about such traumatic experiences. But I think one of the things that really helped with the process was that we had quite a open discussion space that for like the peer researchers after the interviews to be able to kind of speak through some of those challenges that we felt we might have faced or that had come up whilst we were doing the interviewing. So I think that might have been probably one of the more challenging aspects of the Co-Pics project, was kind of being able to hear experiences that reflect your own lived experiences and also work through that while still being able to do honor and justice to the participants that you're interviewing.
I know that you've worked very closely with kind of Tanya, and we must thank the McPin Foundation as well for their collaboration on the Co-Pics project. But what do you think was most helpful in supporting you to work through that process?
I think having like the openness of, I guess, us as peer researchers to be able to discuss how we felt through the interviews, but also like you mentioned, the project management in the space of in the Co-Pics project, being able to support us and kind of trying to think of how to word it, but like in terms of the supports that were embedded throughout the project, like we had those informal spaces, but obviously our project management and line management were also aware of these challenges and also able to support us and be able to give us the space to pull back and increase our engagement in terms of the interviews. So yeah, I guess that's probably what I'd say in terms of how McPin has been able to support us. But I think the awareness of the fact that we're doing such challenging work and being able to kind of have the flex around that work was really important.
Yeah, and I think it is really important for us as researchers to reflect on how we interact with the data and the stories that we're hearing, and particularly working with people who don't often get the opportunity to tell their stories. And I think that would probably be true of some of the people that you guys worked with in ATTUNE as well, Jack. I don't know if you would agree with some of those comments that Davina shared.
The importance of being able to do them justice and capture their experiences in a way that reflects how they want to is the utmost of importance. Yeah.
So can I ask, what would if you had to give one key piece of advice to research teams that consist of creative people, academic people, people with experience, embarking on these big research programs that really aim to foreground the voices of people who aren't often heard, what's one key piece of advice that you would give to them? I don't know if we've lost Simran, so I'll invite Victoria and Nimra to reflect on that as well, or share answers. I know we've got Simran back. Simran, do you have any ideas on that?
You might have to repeat the question for me.
So what's one key piece of advice that you would give to research teams that consist of lots of different types of professionals, as well as people with lived experience who are embarking on some of these big research programs that aim to make sure the voices of people who aren't often heard are heard and represented?
I think just setting enough time for it. I think we get so busy and bogged down with trying to make sure that we get everything in place properly and everything starts, because we have to do everything within a contracted period of time, that sometimes that can be overlooked. But even just weekly meetings or setting aside regular in-person meetings so that everybody can get to know each other and how everybody works in the different interdisciplinary spaces that we are in makes a huge difference going forward. And I think that's something that we've learned a lot in ATTUNE in terms of how people work throughout workshops, facilitating, working PPI, writing papers, if public speaking. I think there's a lot that has just come out over having the time to get to know one another. That's what I would say, at least.
Jack, do you want to go next while we're on the ATTUNE, guys, and then I'll come to Victoria?
Sure. I think Simran can correct me, but if I misquote her, but Anna Mankey Williams, who's recently retired, really, who worked with a lot of the young people, really emphasized the importance of the equity of the offer towards young people, and how many young people, especially those that are harder to reach, might not have access to internet, might not have access to modern digital technology that is advanced enough for this stuff, might not have a Wi-Fi connection, might not be able to access the project needs. And it's important that in terms of the way in which we offer the research to young people and the opportunities that we offer to young people, that we have that in mind. A lot of the young people for ATTUNE have gone on to do really wonderful things. I know, especially at Kent, there's 2 of them have gone from undergrad to postgraduate PhDs, and one's now an author, and I'm now applying for a PhD. But we all live very busy lives as young people, and we wouldn't have necessarily been able to commit what we did to ATTUNE without the offers that we've been getting and the reassurance that we would be paid for our time, that we would have the connections there and the ability to join things there. So yes, I think that is probably the thing that's important to me. Yeah.
Thanks, Jack. Victoria?
It's just building on a bit of what both Jack and Simran have said. So in terms of the lived experience advisory panel, the sort of more formal lived experience into the input into the study and peer research here. And I think similar to what Simran said, but also having a sort of agreement of what the roles and expectations are, but allowing like flexibility and ongoing dialogue around that, but actually people understanding what the role is, their input into what they would like the role to look like, is really important. And similarly to what Jack said in terms of the participants with Co-Pics, we had to do a lot of work to improve accessibility. So sometimes the professionals would go to the participant's house to bring a laptop because they didn't have a laptop. We would provide taxis, and then we probably didn't anticipate as much need in that accessibility with the budget. So ensuring that you do have sufficient budget, and the participants, some of them needed quite a lot of support to attend the workshops. And Nimra and the other postdoc researcher, Tara, spent many months building up a relationship and a trust with those participants before we even got to that point, and they knew what the participants needed to facilitate that support. So sometimes it was a reminder the day before, sometimes it was it being organised far in advance, and knowing that was key to really allowing that supporting that participant to be there in the way they wanted to. That's all I had.
Thanks, Victoria. And I think that actually speaks to one of the comments just come up in the Q&A asking about approaching marginalised communities and specific strategies for recruitment. So thank you. You've kind of unintentionally answered, I think, one of the questions in the chat, because I think it really was about taking the time to build relationships with different communities and participants and understand what they need. Nimra?
Yeah, so just really adding to what Victoria said, I think taking the time to build those relationships with participants, especially when you're dealing with population that is really marginalized. For instance, most of the participants on this project and on the previous project that I worked on as well, which was people from UK, Bangladeshi and Pakistani communities, is that sometimes they've never been invited to research project before. And then the research methods that we use, for instance, qualitative interviews or focus group discussions, only allow meeting the participant once and then asking them like really, personal questions and asking them lots of information. So that can feel like very extractive. And then researchers not going back to the participants and sharing the findings of the project. And I really like the term which Roshi mostly uses, that helicopter research, where you just go take collect data and then forget about the participants. So I think one of the things which we I think did really well in Co-Pics is that through photo voice workshops we engaged with participants through 3 different workshops. Then we had the exhibitions of the photos, and so we've been engaging with participants and to a point where they thought that it was some sort of therapy and it was not just data collection. So I think having that kind of relationship building with participants is really important.
Thanks, Nimra. There's another comment from Tasman saying, as some of the research happened during the time we had social restrictions due to COVID, did you have to approach your engagement in a different way whilst remaining true to your hypothesis and research goals? So I think that's more relevant to probably ATTUNE and Co-Pact, more so than Co-Pics. I know for Co-Pact, we had to adjust some of our methodology for it to be more online, and it was particularly during the photo voice stage quite challenging with some of the NHS trust and some of the restrictions that they had around venues. We've always endeavoured to hold all of our workshops away from NHS spaces, particularly due to some of the experiences that people might have had with the NHS. So that was a really important point to us that we weren't willing to compromise on, which did make it quite difficult and somewhat delayed the research at points. But I think kind of similar to some of the comments that have been shared by the rest of the panel today, is it's always been really important to kind of go back to the voices of the people who are most impacted by the problems and what their needs are, and make sure that we don't compromise those kind of research goals. Simran, Jack, did you have anything to add to that?
I think actually with ATTUNE we got really lucky because I think we were still doing ethics around the COVID time. So in terms of recruitment, it was post-ethics, so we had different recruitment challenges outside of COVID.
So then a final question that I've just seen in the Q&A before we have some closing remarks is, all the projects seem to have learnt a lot during the study. So if you had the opportunity to do the research again, what would you do differently? So I'll ask for like one sentence from each of you as to one thing that you would do differently if you had the opportunity to do it all again. And just while you're thinking about that, I've just noticed a comment from Irene, who's one of our fantastic R&D teams, in the chat, that I'll just read out because I think it's a really lovely reflection. And it says, Co-Pics has really helped our R&D to network with other departments within the trust and community. Each work package led to identifying professionals who look after the marginalised group of patients. It was difficult to get them round, but with the efforts of NIMRA, we're in the right direction. So I think it's really important as well to think about the impact on the infrastructure locally of doing this type of research. So thank you so much, Irie. I know it's been absolutely fantastic to work with you on Co-Pics as well. So any reflections on one thing you would do differently if you had the opportunity to do the research again?
I think from me, it would be to try and include more funding for PPI work and recruiting young people. I think that was one thing we struggled with, especially in different regions like Cornwall, where the kind of, like as Jack mentioned before, it was different expectations, and the equity was with what the young people needed was different to young people elsewhere. So that was a demand that I think we hadn't quite expected. So I think we would do that differently.
Thanks, Simran. Jack, do you have any reflections of what you would do differently?
Ooh, I think I'll mostly echo Simran's. I think, yeah, probably getting, although I don't quite know how, trying to get access to more communities and more voices from young people would be amazing. We've got quite a lot of people, but the more the merrier.
Fantastic. Davina?
I think probably one thing I would want for us to have done maybe differently or done more of was push for I guess more recruitment on bigger numbers so we could hear more stories and get a wider set of data to represent the diversity of experiences when it comes to psychosis with people with long-term health conditions. But yeah, I guess that's probably what I'd say. Push for more representation and diversity of experiences.
Victoria?
It's a really difficult question, isn't it? I'm not sure what I do differently, but similar to Davina, just because it was really challenging and then the timelines became very compressed, always felt like you were having to catch up and do things as it happened. But I think the only way around that would be if someone else is doing this kind of work, taking some of that learning and experiences that then they, from the beginning, I don't think would maybe encounter as many challenges. So perhaps more like just a comment of sort of sharing this kind of learning about this type of work in this kind of space with these type of groups of people. Yeah, I'm not sure if that's a cop-out.
That's fine. Nimra?
So I think there was a learning curve in terms of recruitment. Towards the end, we started to recruit really well, and there were certain tools and strategies that we started to use. So I think if I have to do the project again, I'll start doing those from the beginning. Yeah.
Thanks, Nimra. So thank you ever so much, everybody, for joining us. Thank you to all of our speakers, and thank you especially to Eve Rogers, who works with us in the CHiMES team and set this up for us. This is the start of something new, as Cam said. It is something that we're hoping to do probably twice a year. So if you are interested, please do email the CHiMES account, which I think Eve has kindly put in the chat for me. we really want to kind of build a community around the type of research that we do and the themes that we cover. And hopefully in the longer term, that will help to meet everyone's ambitions of doing this research at a larger scale. So thank you ever so much to everyone for joining us today. And we hope you to continue to stay in touch with the CHiMES and to see you at future events. Thank you again.